All right. Welcome, everybody. My name is Seth Gustafson, and I will be doing my presentation on ending homelessness, enhancing client care via research. All right. So, my placement is at the Pavilion. We are a behavioral health institution, I guess you would say. We have inpatient services for adolescents, children, adults. We have residential services. We have schooling. We have substance abuse. We have a lot of services like that. So I've been doing my internship on the hospital side, dealing with adolescents, children, and adults. I've recently just moved into assessment, so at the tail end of this, it's kind of really cool. I've been able to look at a bunch of numbers, look at a bunch of data, and I've been able to actually figure out a lot of the issues that we have and a lot of what we can fix. So, that being said, we will go on moving forward. So, homelessness really affects a great deal of people. As you'll see in the next slide, there's a lot of numbers, statistics, and things like that, but the main things are these homeless individuals, they don't have any family or support, and if they do, they're really not close by. They have health problems, obviously, from being outside and not having shelter. They don't have access to medications, things like that, and they really just need compassion and help. So what we're really looking at here is nearly 1.5 million Americans are homeless every single year, and this number has been increasing. Mental health affects this number in a large way. There's 43% of all homeless individuals are diagnosed with a mental illness, and that's not even including the number that go undiagnosed. There's just too much money being spent on shelters, hospitalization, jails, etc., instead of solution-focused interventions. A lot of what we're going to talk about for my internship project is recommendations and guidelines set up via these grand challenges that we've been talking so much about. And, it's just we need more interventions that focus on the bigger picture, right? So these vulnerable populations we're talking about are youth. 20% of all homeless individuals are youth, actually, and that's ages 18 and under, and then especially those over 50 make up so much of the homeless population. And obviously we have our stakeholders, the policymakers, the practitioners, ourselves, obviously, researchers, community members, property, housing owners, mental health institutions, jails, hospitals, everything like this. There's so many stakeholders with these homeless populations because we need everyone to be on board to fix this. So, my proposed solution, obviously you see it's these 6 bullet points. It's a pretty big plan, right? So the first thing, up for the challenge, right? Hashtagging, social media awareness. This is such a big way to reach so many different populations, as well as spreading this awareness and getting people, intervening with our cause, right? So then we have our guiding principles, which we're also going to talk about. We're going to summarize the direction social work is moving with homelessness, as well as the recommendations the field of social work is giving us. So specific solution-focused opportunities that furthers these guidelines principles to give us as practitioners and the policymakers directions to go. Research-informed practice, right? This thing we've been talking about all the time. Research-informed practice, practice-informed research, and using these evidence-based practices for our interventions. So my project throughout this year has been incredibly long and tedious and strenuous, and it's just been calling so many different places, getting all this information, because what I've developed is this homelessness and aftercare resource guide for our case managers, insurances, clients, and our discharge planners. Because if we know where these individuals want to go and we know the services they need, the aftercare planning can just be so straightforward. We can make those appointments early on so that when clients are discharging from us, they have a structured plan that they can follow, that is going to give them the best opportunity to succeed. And then, of course, what the pavilion has done in terms of putting this into action. And we'll go into that towards the end, but a lot of collecting data. We have baseline measures, we have the intervention, and then we have post-line measures as well. So we'll discuss that in a bit. So the importance of social media, like I was discussing before, this hashtag up for the challenge, right? So there's just so many outlets in social media that we can do. Twitter, for example, and you can find and attend events. By putting this hashtag, so many people have done this, so that way if you just click on the hashtag on Twitter, it brings up every time that hashtag's used, and you can sift through that to find things. And I actually 4 days ago attended this webinar on April 18th about the grand challenges and how we can use research to inform what we're talking about with the grand challenges and ways that we can go about intervening and helping out our policymakers and making a difference, which I thought was so awesome. I wish I found out about it so late, and I wish I could have told you guys about it earlier so you guys could have attended. But it was so informative and it was great. Obviously, we also have Facebook. They have a Facebook page for the grand challenges, as well as a lot of homelessness information on there, right? And there's so many populations on Facebook. At least my mom and dad, these older individuals are on Facebook, but the Twitter and Instagram aren't really their thing. But Facebook definitely is worldwide, all populations, which is great. And obviously Instagram, sharing pictures, locations of rallies, conferences, etc. Just a lot of things out there that you can really just get informed about as well as take action with. So the grand challenges, I really surfed around the website, really got to know a lot about homelessness, and that took me in a whole bunch of different directions. But the guiding principles basically that we're looking at are prioritizing housing over shelters and permanent supportive housing over transitional housing, right? Because if we can establish this permanency in the housing and not have short-term solutions, then there's going to be more success, right? Stability will help these individuals out. And then obviously valuing the client's choice and direction, right? If they want to go south, letting them go south, finding them resources down there, wherever they want to go, instead of forcing them to go away. And that has definitely been a challenge, because I don't know if you guys know, but in Illinois there is such a lack of resources right now, and it's just been crazy. But we have made some progress, as you'll see, and I think a lot of places don't get their name out there. They don't advertise, but I think at the end of the day, we just really need to find them. So that's why I'm putting together this guide and manual. So we also need the third principle is matching flexible support services to unique client needs, right? So we want to give them the support they need. We can't just say like, oh, you need this, that, and the third, right? These one-size-fits-all programs, we have to treat each individual as a unique individual. So this is what we have to do, and this is the direction that we want to move forward with. So, first recommendation, expand access to housing subsidies, right? We need to have more housing choice vouchers. We need to have more options for these individuals to use this housing first, right? We really need to focus on this. I can't stress that enough. And the second recommendation, ensuring that evidence-based interventions are coupled with housing assistance programs, right? So we need to use our psychosocial interventions to support clients, right? If they need medication management, If they take their meds and they need, more social support, getting them into these support groups. We need to bring the kind of culture of homelessness and there's so many people affected by it. We need to, have support groups for them. We need to provide them with this shelter and this safe space for them to discuss what's going on. I think this is huge. So, third recommendation, we need to develop and evaluate housing-led interventions for specific populations, right? Tailoring these interventions to the unique populations like I talked about before, but also taking in the client's knowledge and understanding and choice of where they want to go, and we have to use all our resources to do this. All right, so an example of this is I was surfing the web and I found this great YouTube video basically of this presentation that these people did out east. I think it was around Baltimore. the power of eviction data, putting numbers into the public hands. So what they're really pushing for is getting the data from these private companies and these governmental companies and putting it out there, right? Getting it out there, advertising it, because knowledge is power. We need to put these hard numbers into people's hands that will do something, So we need to, as stakeholders, this accessible data will catalyze catalyze evidence and based catalyze evidence-based solutions and decision making to aid this crisis, right, of homelessness. We need to get these numbers out there, people. So, ensuring that the pavilion does its part, right? So I've been focusing on homelessness and reading so much about it for basically the entire year. So I've identified the major issues that we have as a facility, right? And this has been through supervision. I've been to presentations. I've gotten things authorized for me to obviously take that webinar, go to different events like that, and just gain more knowledge about this, and then present it to the higher ups and the powers that be, so that way we can make a difference. So our major issues at the pavilion are we have difficulty aftercare planning for homeless clients because there's just not a lot of services that we know about. We've had increased rehospitalization rates like crazy, and this is when we discharge clients, having clients come back almost immediately. And what we used, or what I used for my data, as you'll see, is this 3-month window. We have a lack of insurance availability, and the clients don't know what types of services they can get with their insurance. A lot of homeless individuals can have access to these different insurances that they don't know about, and they're just not taking the time to get it, and this can help them in just so many ways. And obviously, as I talked about before, in Illinois, our resources are so slim, and this is especially for the homeless youth, which we will get into in a bit as well. But it's just astounding how we just cannot have, we just don't have these services. So this is the cool part. I'm so proud of this, guys. I mean, I don't want to brag or anything like that, but this has been such a hard semester in terms of, and a hard internship of knowing what to do and then going back and collecting data, but then being able to go into the computer to find data as well when I wasn't sure what exactly I wanted to do. So that's why having access to those computer systems has been so clutch. So, and just the amount of numbers that I've gotten, the statistics are so good, which you guys are probably reading right now, and that I'm going to talk about for sure. So, difficulty in aftercare planning, like I talked about before. So 14% of clients discharged to stable permanent placements. 14%, that is it. That is not a lot at all. And 34% went to long-term shelters. And again, like, okay, 34, like 1/3, like that's pretty good. But again, these are long-term shelters, and by long-term, I mean we classified that as over 2 weeks. You're able to stay there. That's long-term, because a lot of these shelters, it's just a couple days here and there, and then if you drop positive for any drugs, you're kicked out. If you get in a fight, you're kicked out. It's just so unstable for these individuals that are already at risk due to their homelessness. And oh my gosh, the astounding rehospitalization rate was incredible when I looked at the data. 3 months, in 3 months, 55% of our clients were getting rehospitalized. And the lack of insurance availability, we had on average 14 clients per month that were referred to us by SAS services, as well as crisis services, and we had 14 clients per month that we couldn't take in because they had to be self-pay, and obviously as homeless individuals, they can't pay, right? They don't have this financial, availability, and it's truly, it was truly awful to see those numbers. And in Illinois, our discharges for residential youth reduced by 24% from the same time in 2016. Right, so in 2017 there was such a drop off in residential services that, I mean, this 24% less, availability. It's just truly heartbreaking. So by BMN in this next point, this is beyond medical necessity. So By this I mean youth that are hospitalized and are ready to be discharged, but they don't have a place to discharge, right? So it's taken them 3 months after they were beyond medical necessity to find a placement. And in 2016, the average stay was 47 days. Like, from 2016 to 2017, the services for youth has just shut down, right? Like, the residential kids are just not having a place to go, and then kids that are hospitalized and locked out don't have a place to go either, because it's kind of this ripple effect, right? Like, if kids can't discharge into residentials because the kids in the residential can't go to less restrictive facilities, and especially when they're ready to step down, they can't step down, which is just it's they need to step down for themselves and their treatment, but they're just unable to because of our lack of resources and beds available. So, okay, so I really kicked off my manual. It was pretty much ready around February 1st, right? So this is when I wanted to roll it out. I wanted to roll it out so much sooner, but just compiling everything took so long. But as I was compiling it, it was important to stay strong and keep doing it. I was calling referral sources. I was calling all around the state to mental health institutions, calling around the state to hospitals, and just saying, like, where do you discharge your homeless clients? Where can they go? Where can they go? Where can they go? You know. So this was it, it was a lot of phone time, guys. Just calling around, try to compile all this data, and let me tell you, for the people that live down south, it's so sad because there's just no services down there, and it's just everybody's so spread out in these country towns that there's just no resources down there, and there's a lot of people that do telepsych. But in terms of homeless individuals and a place to stay, it's so hard to find things. But we ended up, finding a lot of resources, kicked it off February 1st, and this data I am so extremely proud of. So, aftercare planning, the first point we were talking about before, 26% stable permanent placements, which, if you don't remember, before it was 14%. So obviously this is a 12% improvement, as well as 62% getting into long-term shelters. This was amazing from 34%. That's a 28% improvement. That was really cool to see. So we're discharging, as you can see by the numbers, 88% of our clients to these pretty structured environments where they can go, versus before it was only 46. So very proud of that. Rehospitalization rates, 22% in the first 3 months. And obviously that number is a bit skewed because of the people that we've discharged recently. We don't have that 3-month follow-up window, but 22% rehospitalized, and that's it. I think that 33% improvement is pretty great. And then April 1st, we got 80% of all Medicaid accounts transitioned to managed care accounts, which we do take. We don't take straight Medicaid, unfortunately, but we got them transitioned into managed care accounts, and now we've been able to accept more clients, and we have 100% admission rate for homeless clients. And well, now it's been 22 days. I haven't checked, but in those first 18 days, we had 100% admission rates for our homeless individuals that were being referred to us by crisis teams. And then the homeless youth BMN rates, and again, the youth is where I really ran into trouble, because now the stay is at 84 days versus 3 months, around 90 days. So, they typically require to be discharged through foster placement, residential care, somewhere like that. And like I've explained before, there's just such a lack of resources for these youth. It's just awful. So, call to action. We can donate money. I give you guys the Grand Challenges website. There's the National Alliance to End Homelessness. There's multiple ways that you can get out there and do something good for the community and for these homeless individuals. But also, I think the more important thing is becoming an advocate, right? We can let our voice be heard. We can stand up for those that can't advocate for themselves. As social workers, I think this is huge, and I think that's something we really need to get behind. So this is it's something that we can really do. So some challenges that I encountered, like I referred to before, too, these southern counties, it's just so difficult to find resources. And then also, like I talked about, these youth referral options, there's just not a lot of placements. So then when our kids get hospitalized and they're quote unquote a lockout, that means there's been neglect, physical abuse, something like that that's happened, or that their parents won't take them back or their guardians won't take them back, right? So then there's DCFS involvement. And then now DCFS needs to discharge them to a safe, or they need to be discharged to a safe place. But they're not being prioritized by DCFS because they're technically quote unquote in a safe placement. So other youth that are in shelters and on run are getting hospitalized before these kids that are in hospitals to go to these, I mean, these very few beds that are available when they come available. So that's been the really difficult part with our youth, with our homeless youth. And the recommendation of choice, that we talked about earlier, the second recommendation and the second guideline by the social work community, it's just so hard. If somebody wants to go somewhere where there's no options, you want to find them the closest place to where they want to go, but sometimes that's just so difficult. But the more we keep finding options, the better we'll be, and the better we'll able to fit the needs of our clients that get to go somewhere where they want to, and just continuously working with referral options and resources about improving our ability to have knowledge, for these places that are popping up. So, some lessons that I learned throughout this whole thing. Planning, right? We need to get started on aftercare services immediately. So if we know an individual is homeless, that's something we should initially just get working on instead of waiting to plan discharges until the end, which again, a lot of case managers, don't have, they just have such high caseloads that it's just so difficult, it's so difficult for them to get started on discharge, do the assessment, do the treatment planning, all this stuff. But now, again, why I just saw such a need for this manual that I developed is, we just need it because the caseworkers can go, okay, you are from this region, you will go here, boom. And then you're setting up those aftercare services immediately, and it's just so much quicker, right? And then another thing I've learned in these past 18 days of being with assessment is insurance companies love plans, right? So if we can tell an insurance company right off the back, like, hey, we are planning to do this and this and this, and we're going to discharge them here, we're going to give them these services, this, that, and the third, they're more likely to authorize days for them to be with us longer so they can get the treatment they need, but then also to have the plan to step them down to a structured facility, as insurances like to see that too, so that, again, we're reducing that rehospitalization rate. And service excellence, developing relationships with referral sources, clients, everybody you come in contact with, because you never know when you're going to need something from them, So in calling these referral sources, I made, a lot of good connections, and I was able to have them call up again, and they wanted to refer people to us because they're like, you guys have your heads on straight, you guys have the aftercare planning down, you're trying to find you guys have a solid plan, so we're of course going to refer clients to you because we think you're going to give them the best care possible. And the importance of research and quote unquote hard numbers, right? So research informed practice and practice informed research. Like, we need to get these numbers for evidence. We can use them for grants. Corporate loves to see numbers and how we're improving. Insurances like to see numbers. Obviously, if you can show people numbers, you're more likely to give raises, promotions, interventions, evidence, etc. There's so many things that research and data does for us. So again, it just reiterated that fact to me for sure. And then the importance of focus areas as a profession. I love this idea of the 12 grand challenges, because what social work's doing is they're allowing our entire field to focus on these certain areas that need our help immediately, right? Instead of not having any direction at all, and then our resources are spread so thin throughout so many different areas, they've focused on these 12 things, so now we can, pick one of those and go, and that's why I was able to identify homelessness and go through there, and I think it's just been great. And that's my presentation, guys. I really hope you enjoyed it. Again, I spent so much time and effort, as I'm sure you all did too, just getting to this point and being able to put it all down. I'm sorry for the uhs and the stutters and the ums, but there's just so much to talk about. I wish we had like a 3-hour conference about this stuff, right? So, I'm really glad you guys watched, and I really hope you guys comment and ask me questions, because I really spent, a lot of work on this homelessness stuff, and I really think it's an area where we can improve. And I'm really happy with the progress that we've already made, especially at the pavilion. So I look forward to hearing from you guys, and I had a great time doing it. Thank you guys so much.